what I'd like to show here, those are different kind of melanoma, and the point here is that there is not one melanoma, there are many melanomas, and so there is what we call skin melanoma with chronic sun damage. This one is without chronic sun damage. Melanoma arising from mucosal surfaces, which is the case from uveal melanoma, which is in the eye, and melanoma in acral surfaces. This is the foot. Okay, this is the sole of the foot of someone, and he has melanoma. What's important to know that is each kind of melanoma is associated with a different mutation. For example, this kind of melanoma is associated with 60% of BRAF mutation and 20% of NRAS mutation. BRAF is a gene, NRAS is another gene, and you see that these genes are mutated in this kind of cancer. However, KIT, which is another gene, is not mutated at all in this kind of cancer, or this kind of melanoma. However, if you look here in the acral melanoma, you see that a lot of them, or many of them, have mutation in the KIT gene. Okay, so now we have drugs, and as I said before, which will block specifically one kind of mutation. Here we have this drug which has this weird name of PLX 720, and this one is going to block the BRAF mutation. So if a patient has mutation in the BRAF, if we give them this drug, we are able to cure their melanoma. Okay? And if we use this drug, we are going to block both BRAF and NRAS mutation. If we use this drug called imatinib, we are going to block the SKIP mutation. So it's very important to know this, because if we have patients with, if we treated this patient with this drug, we would have no effect. Okay, so we need to know what mutation is in the patient in order to treat the patient. This is called scientific-driven treatment, and this is new. This is very important, and this is what most of the treatments are moving towards right now. And so this is an example of a patient that has been treated with one of these drugs, and here is shown something called PET scan, and the PET scan is like a radiogram, or a scan of the patient, which will tell you which cells are dividing the most. And here, this is the leg of the patient, and each black dot here is a tumor. It's melanoma. And so when we look at the patient after 6 weeks of treatment, we see that all the black dots have disappeared, almost disappeared, which is amazing. Okay? And then here, after 12 weeks of treatment, the patient has no melanoma cells anymore. And this is great. Okay? And if we take a PET scan for other patients here, you see that the black here, which is all liver, has disappeared. Here is another patient in the lungs, nothing in the lungs. Okay? Here, this is a patient which was treated very far from here, and you see that everything is gone. Same thing here. Okay? So these targeted therapies do work, and the very interesting thing is that they work specifically according to the mutation that's in the patient. Okay? So, but the problem with these therapies, which are not perfect, is that so their advantage is the fact that they are specific. They kill only cancer cells because they kill the cells that have mutation, so they are less harmful to normal cells as opposed to regular chemotherapy. But the problem is that the cancer cell develop resistance. So most of these patients will be cured and then they'll be sick again. So the cancer will come back. So we need to find something else to do. Okay? So now, okay, I guess something is wrong. So we have also the immunotherapy, which is the treatment of the disease by inducing an immune response. I don't know if this is simple enough, too complicated, so if you have questions, just ask, okay? So, and this is a cartoon here that shows how the immune response function, okay? So when you immunize somebody, or when you have, so this is an immune cell, or T cell, okay? And this immune cell or T cells could fight any pathogen that comes to you or cancer cell. And here you have another cell which will take a piece of the tumor and show it to the T cell. Okay? So when it shows it to the T cell, this T cell will know that it has to go or will be activated and knows that it has to go and recognize something like this. Okay? It's like a dog. You show him something and he goes after it. So it's the same thing for the T cell. So then now this T cell has seen a piece of the tumor because of this cell showing him this piece of the tumor, so the T cell is activated. And then what happens is that you have, so this is a cell that is ready to kill. But then what happens is that you have another molecule called CTLA4, which is called a co-stimulatory molecule, which can block or stop the immune system from killing everything. And the reason why this happens is that this prevents you from getting autoimmunity, which is your immune cells killing your cells themselves. And I'm going to try to make this easier by showing you this example. So it's basically like a car, and when the cell, that cell that I told you is an antigen-presenting cell, presents a piece of tumor to the T cell, it's like if you were going to start your car, okay? So you're starting your car and your car is ready to go. But then when you have activation of the T cell, it's like if you are pressing on the gas of the engine and then the car is running, right? And but then there is something which we call the brake, and that's what the analogy I made with CTLA4. It's something that will tell these activated cells now not to kill everybody, but just to kill the tumor cells. So it prevents from killing something else than the tumor cells. And then the vaccines, which are what we also give to the patient, will basically steer the cells to kill the tumor itself. Okay. I know that can be gibberish, but that's the only way I can explain it. Okay. So what we are trying to do is basically give something that will block the brake, okay, in order to allow for the car to run and kill everybody. Okay, so and this is an example of a patient for whom anti-CTLA4, which is the anti-brake protein, will allow for the immune system to actually be able to kill the tumor cells. This is the patient at baseline. This is the skin of the patient, and you see tumor everywhere. And this is at 6 weeks of age. The patient doesn't have anything anymore except black spot, which is just a signature of the immune cells having killed the tumors in the patient, okay? And this is another example. This is a CT scan. This is a tumor here, another tumor here, 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 and here. And those are the lungs of the patient. And you see everything has disappeared, okay? And if you can see here on the brain, this is a tumor. There is nothing anymore here. Okay, so the immunotherapy works, okay? It does work. And here is another patient with tumors here. They start to regress, and they have completely regressed.